And this is, I guess, a word for the teachers amongst us, and I believe there are a few teachers here. The most important thing when you suspect a child might have the condition is to communicate with the parents. But it's vitally important to discuss observations of what you're seeing in the class rather than a diagnosis or a medication. And here's a tip: don't say your child needs Ritalin. And maybe I'm preaching to the converted this evening, but believe me, it happens. And there's no worse way to start this journey off. And it's an emotional thing. It's a hard thing for a parent to hear that their child has difficulties, any kind of difficulties. So it needs to be broached sensitively. And then, of course, one needs to consider who the most appropriate professional might be to refer to. And it's a bit of a confusing area because there's actually overlap between at least 3 disciplines in medicine, all of whom treat this condition. People like myself, a child psychiatrist, as well as a pediatrician with a special interest in developmental conditions, or even a neurologist who specializes in children, all might be appropriate. So it's not correct to say you have to see a neurologist or you have to see a pediatrician. You really have to see one of those 3. And I dare say, in our environment of scanty resources, there are times where even a GP is an appropriate referral source. You get some GPs who are interested in the condition and some who aren't. So even that might be an appropriate referral source. Thanks.